Sanjay, what is an asthma attack and what are the typical triggers for an attack?
So an asthma attack is when the underlying inflammation or swelling gets much worse. So because of that, then there is even further narrowing or tightening of the airways. There is more mucus in there. So all the symptoms that patients have get much worse. So they usually have more cough, wheezing, tightness of the chest, more and more shortness of breath. And this can have a wide range from being just a mild attack to all the way to being, life-threatening and requiring people to come to emergency rooms and getting admitted to the hospital. So there's a fairly large spectrum of how severe these attacks can be. They are a very important part of asthma because they need to be managed and prevented with our treatments. Now, what triggers an asthma attack varies. The most common triggers are things like allergies, especially if you have underlying allergic asthma, and then you get exposed to that specific allergen which is causing your asthma. Then, for example, if you have allergies to cats and you go to somebody's house and there's cat dander all over, that could trigger an asthma attack. But there are many a time other causes, things like even emotional distress can trigger asthma. You can have asthma attacks because of exposure to smoking or secondhand smoke, strong odors or perfumes, changes in the temperature, ozone levels can trigger asthma attacks. So there's a wide variety of triggers, and again, we try to identify in particular individuals as to what their triggers are, because avoiding those triggers is also a very important part of treating asthma.
When asthma develops in childhood, we also very commonly see viral illnesses in children, and these can be an important trigger in the child as well. A virus causes inflammation, and that inflammation just adds itself on top of the underlying inflammation that's already going on in asthma and can trigger an attack as well. So this could be an important trigger for some people. Exercise also is an important trigger for some and needs to be approached in a little bit different way than just these triggers that happen unexpectedly. Sometimes we can plan ahead for dealing with asthma in time of exercise.
That's true. And even in adults, viruses can trigger asthma. But I do want to emphasize that bacteria are actually an unusual trigger for asthma attacks. So many a time antibiotic use is not necessary for treating an asthma attack.